Okay, class. I am going to go over some things that I would have covered in class today. Basically, we're going to discuss reading assessment and the purposes of assessment, why we assess our students. So, as we're going through this, you should recognize some of this from your assessment course. Okay, so there are four main reasons that we assess our students. Let's take a look at the first one. We assess students in order to screen. Now, the purpose of screening is so that we can find those students who are at risk. So, in order to do this, this is usually administered to a very large group of students. They may have to be broken down into smaller groups or possibly even individually, but because you want to assess pretty much every student, you want to screen every student, you're going to have to find an assessment that is quick. These are usually simple measures. Usually, the measures that will be used are only for the purposes of screening, not to measure achievement or anything like that. It's very easy to administer in a short period of time to a large number of students. And that's just to keep it efficient, time efficient. It's going to tell us overall which students are going to do well and are on their way to be successful in the classroom. And it's also going to tell us the ones who are at risk or the most likely to struggle in reading. Now, when you identify those students who are possibly at risk, because remember, this is not a definite at risk, you're going to identify those students and then take it a step further and do a more in-depth assessment to figure out, okay, are these students really struggling readers? And if so, what areas of reading are putting them at risk? The second purpose of assessment is diagnosis, and this is used, to diagnose various disabilities, various areas of reading disability. Intelligence testing sometimes is involved here, so if you think about your intelligence test that you learned about in your assessment course, that's what this is. So typically we administer these tests one-on-one. They are very thorough and they help us to identify the specific skills that students are likely to struggle with or be strong in. A diagnosis assessment can help us identify an area for remedial instruction, or if you're thinking about RTI, it could help us to move a child into a second tier. But it can also give us information about what other assessments we may need to give in order to actually get at what the problem is here. This diagnosis assessments really should, this last bullet down here, I know the bottom words are getting cut off a little bit by this piece of technology that I'm attempting to use for the first time here. But this last bullet says, should be conducted by highly trained professionals. So, will special education teachers ever administer an IQ test, a test of intelligence? No. Typically, those are administered by school psychologists, people who have been trained, and actually, in clinical psychology programs, typically there is a whole entire course just on how to administer and interpret intelligence tests. So keep that in mind. You will be able to do other types of standardized testing and normed testing, but a psychological test you will not be doing. The third one is progress monitoring. So once we decide, okay, we're going to give this particular student an intervention, we are going to monitor his or her progress. This is also called formative assessment because it helps us to kind of figure out what type of teaching we're going to use, where we're going to start, etc. So progress monitoring can be administered in a group, but it can also be administered individually. The most common type of progress monitoring, CBMs, for example, are typically administered individually. They're fairly quick and they're given at regular intervals, so it's not just a, beginning of the year and then an end of the year thing. The end of the year would be more summative, which is what we're going to talk about next. This is to help us see the progress that students are making. So typically, we'll give a CBM, every couple of weeks or even more frequently than that sometimes. Very easy to administer. They help us, again, determine who's excelling and who is struggling. And actually, they will also tell us what areas the students are struggling in and allow us to adjust our instruction for those students. This bottom bullet is important too. If we think about IEPs and how we have to determine the best methods for instruction and the best environments for instruction, CBMs and other progress monitoring measures help us to do that as well, to figure out whether what we're doing is working. And if it's not, we have to do something else. In the RTI format, possibly that means move into the third tier. Not necessarily, but possibly. And the last one is measuring achievement, outcomes, summative assessment. This just means like overall, has the student learned what we wanted them to? It's typically a group administered test, usually norm referenced, meaning, and this should be a review, norm reference means that there was a huge population of students that are given this test and you get your bell curve, and so you can tell where the student lies in relation to other students, their age, their grade, their level, etc. These are standardized assessments. And a good example of this would be state mandated testing, such as the PASS testing here. The No Child Left Behind mandate, that would be a summative assessment. The tests at the end of the year that students take, and typically they are linked to accountability of the teachers. High stakes decisions are on the line here. And, you can agree or disagree with that. And that's a whole nother conversation. But typically there's some accountability there linked to it. And then the bottom of this is cut off, but this just says, for example, a student's promotion to the next grade, a teacher's pay, a school's future funding level. So those are some of the high stakes decisions that these summative assessments could be based on or could affect. Oops. Okay, so methods of assessment, we can observe students reading. That includes sitting with a checklist, listening to them read aloud, etc. We can do informal reading inventories. We're going to talk about that in detail a little bit later today. And we can do portfolios, which is a good way to see progress over time. Basal assessments, which are part of typically part of a boxed reading curriculum. You have different books and stories in them, and there are tests that go along with those. And then standardized testing. So observation, we can do this in a couple of different ways. Running records, we're going to learn how to do that. This is basically where the teacher or the student is reading aloud and the teacher is making notes about whether they're reading the words correctly, what types of mistakes they're making, and then we can go back and assess that and look more detailed into the notes that we took down while the students were reading. Figure out, what's going on, where most of the difficulties are. Anecdotal records, that's basically just making notes, anecdotal notes about what you're observing in the classroom with the student in regard to reading. Timed reading, that helps us to measure the rate at which the child reads. We call that oral reading fluency, ORF. And then logs of books read. And that just tells us something about the level at the books that that the students are choosing. Are they enjoying reading? Are they choosing appropriate books, etc.? Informal reading inventories are used to determine reading level. We use word lists here. Think of the Dolch list, DOLCH. If you Google that, you will see several lists come up. Those are typically sight words. Then we'll have passages at various levels of readability, and we will also check comprehension, either through questions or through a retelling, have the students retell the story. There are other ways that we can use our eyes. You will be using it basically this first bullet and these sub bullets here. Moving along. Portfolios, this is just a quick thing. It just shows us informal, and that is a very important word here, to measure growth over time. Writing samples especially, you can see growth over time here. Basal assessments, you can quickly read through this, but basically teachers must consider carefully which, if any, of these measures are useful. And then standardized tests. When we use standardized test measures, we have to consider reliability and validity. Reliability has to do with, if I were to give a student the same test several times, will they get the same score every time or fairly close to the same score every time? Now, of course, you wouldn't administer a test repeatedly to a student typically, but this just gives us an idea. This is based on large samples that were given an assessment. And then validity has to do with, are we testing what we mean to be testing? Content. Is it adequate? Is this an adequate sample of the content that we want to test? Is it related to other measures? So you can give one assessment and those scores could be correlated with scores on another measure. Typically, for example, the Peabody Picture Vocabulary Test can tell us something about language development as well as vocabulary knowledge. So that's just an example there. And then the construct. Test measures what it purports to measure. So if we want to measure reading comprehension, does this test actually measure that construct? We have norm referenced and criterion referenced, and that should be a big review from before.